So today we're going to be talking about typhoid fever and the different other infections that are caused by the organism Salmonella. So basically, typhoid fever is a systemic infection and is caused by Salmonella enterica serotype typhi, and it is a major public health concern in developing countries where there's no good water and where the food is not really cooked properly, because it's primarily transmitted through contaminated food and water, and is significantly the cause of morbidity in a lot of developing countries, and this infection is more prevalent in regions that have poor sanitation, and the disease is caused by ingesting of this Salmonella typhi, which can evade the intestinal mucosa and disseminate through the bloodstream. So the signs and symptoms of this typhoid fever: we have prolonged fever, that is fever lasting more than a week, abdominal pain, rose-colored spots on the trunk, diarrhea or constipation, weakness, fatigue, hepatosplenomegaly. So when we are talking about the clinical presentation, so patients typically present with a stepwise fever progression. So they reach high temperatures in the second week. So that is why I said that prolonged fever lasting more than 1 week. So they reach high temperatures in the second week, and they may experience gastrointestinal symptoms like constipation or diarrhea. Neurological manifestations too can be there, like confusion, delirium, and they could reach a stage that there could be complications like intestinal perforation if left untreated. So that is that about the clinical presentation. Then when we come about the etiology, so the etiology of typhoid fever is just basically it's caused by this Salmonella enterica serotype typhi, and this is a gram-negative facultative intracellular bacteria. So it's caused when we eat food or we take water that has been contaminated with this bacteria. This is how this bacteria basically enters our body. So that is basically how it enters our body. So the risk factors of getting this typhoid fever: number one, poor sanitation and hygiene, consumption of contaminated food like roadside food, street food. If you consume this kind of food on a regular basis, there's a high chance you could get this typhoid fever, sometimes without you even knowing, until like symptoms start to really show very well. Then you could also get it if you travel to endemic regions, like regions that region that this infection is high. Like for example, in Nigeria there's a high prevalence of typhoid fever and malaria. So it's like somebody coming from, let's say, the UK now, coming to Nigeria, they have a high risk of getting the typhoid fever because they are coming into an endemic region where it is prevalent. Then immunosuppression too is also a risk factor. When your immunity is very low, you can easily get this infection because your body does not have the what it needs to fight off this bacteria. Then also close contact with an infected individual too is a risk factor. Then when it comes to the anatomy and physiology of this typhoid fever, so Salmonella typhi primarily infects the small intestine, specifically the Peyer's patches, before it spreads systemically through the lymphatic and blood circulation. So for the pathophysiology, this S. typhi penetrates the intestinal epithelium and it invades the macrophages. So the bacteria replicates in the lymphoid tissues and disseminates itself into the liver, the spleen, and the bone marrow. So after this occurs, there's usually systemic release of endotoxins, which leads to this clinical presentation of the prolonged fever and inflammation. So here the bacteria is already inside the bloodstream and is already causing these symptoms because it has already entered the bloodstream. So how can this typhoid fever be diagnosed? The gold standard for diagnosing typhoid fever is using a blood culture, and then we could also use stool and urine culture too, but this may confirm the infection in later stages of the typhoid fever. Then we have the Widal test. The Widal test is very popular. It is a serological test detecting S. typhi antibodies, but it's not very specific because it could detect other kinds of Salmonella typhi. So it could detect other types of Salmonella, so that's why it's not really as reliable as the blood culture. Then we have so other conditions or infections that could mimic the symptoms of typhoid fever, could confuse a doctor or a pharmacist when diagnosing this typhoid fever, is malaria. It almost has the same symptoms of malaria, like fever, tiredness, headache. It almost has the same symptoms of malaria. Then dengue fever, tuberculosis, brucellosis too, because brucellosis is also caused by eating contaminated food, and leptospirosis. So these conditions too can have similar symptoms with typhoid fever and can be mistaken when we're diagnosing typhoid fever. So when it comes to the management of this typhoid fever or the approach considerations, so since it's caused by bacteria, we have to look at the antibiotic therapy. So here we use different classes of antibiotics, and we have the first line and we have the second line. So when it comes to the first line treatment, we use fluoroquinolones, although resistance has started increasing for these fluoroquinolones. So we specifically use ciprofloxacin, levofloxacin. Then we use cephalosporins too, like ceftriaxone, cefotaxime, and ceftriaxone is usually used for severe or drug resistant cases. Then macrolides too, like azithromycin. Macrolides too, like azithromycin, which is an effective alternative, especially in fluoroquinolone resistant strains. Then carbapenems like meropenem, imipenem, which are usually considered when we have multiple drug resistant Salmonella, which could occur. So all these antibiotics, they have a particular thing they target in this Salmonella typhi that make them very useful for in the treatment. Like fluoroquinolones now, they target the DNA gyrase, which is seen in this Salmonella typhi. So they particularly target it, and this will inhibit DNA replication, leading to death of the bacteria. So it's usually used for first line of the typhoid fever because it's bactericidal. So cephalosporins, they target the penicillin binding proteins, inhibit the cell wall synthesis of the bacteria, and cause cell lysis. So they are used in drug resistant strains. Then macrolides, they they target the ribosomes, and they inhibit protein synthesis and block the ribosome assembling of the ribosomes. Then carbapenems, they also have the same mechanism as the cephalosporins, but they are majorly used for multi-drug resistant salmonella. And other things we can use, other antibiotics we can use to, like sulfonamides, but it's not usually first line and is less commonly used due to resistance. And aminoglycosides too, they are used for Salmonella bacteremia in patients that are immunocompromised. This is when we use the aminoglycosides. Then, besides giving these antibiotics, we could also suggest supportive therapy too, like hydration, electrolyte replacement, because of like the lost electrolytes due to the gastrointestinal issues the patient will be having, like diarrhea. So we should also suggest hydration and electrolyte replacement. We could give them zinc, we could give them ORS to just replace all these lost electrolytes. We could give them antipyretics too for the fever management, antipyretics like paracetamol, along with these antibiotics for the fever management. Nutritional support, like we could give them vitamin C to boost their immunity, because this will help fight off the infection. So we could add vitamin C, we could add B complex vitamins too. So these are just supportive therapies we could give with the antibiotic when it comes to treating this typhoid fever. So for the prognosis of this typhoid fever caused by Salmonella typhi, usually with early diagnosis and appropriate antibiotic treatment, the prognosis is excellent. But when we have untreated cases, this is when it could lead to severe complications like intestinal perforation, sepsis, and death. So if the antibiotics are taken on time as prescribed, and basically if the patient is taking their drug, they'll be fine. So that is it. So when it comes to, I also said I'll speak about other infections caused by Salmonella. So Salmonella species can cause various diseases besides typhoid fever. So it usually depends on the serotype and the host factors. So typhoid fever, like we talked about, is caused by Salmonella typhi and Salmonella paratyphi, treated with ciprofloxacin, ceftriaxone, azithromycin. Then we have non-typhoidal salmonellosis. So this is another infection caused by Salmonella, and it's caused by Salmonella enterithides and Salmonella typhimurium. So these ones don't cause typhoid fever. They for the symptoms, they usually cause like self-limiting gastroenteritis, and the treatment is usually supportive treatment, like giving them fluids to replace the lost electrolytes and all that. But in severe cases, you may need to give the fluoroquinolones or ceftriaxone. That is in severe cases. Then we also have Salmonella bacteremia. So this is usually occurs in there's high risk in immunocompromised individuals, and we treat this Salmonella bacteremia with basically the same drugs, ceftriaxone, fluoroquinolones, and carbapenems too in multiple drug resistant cases. Then lastly, we have Salmonella myelitis, and septic arthritis. So this kind of salmonella is common in sickle disease patients and is treated with the normal antibiotics, but when it comes to their situation, we often do long-term therapy. So those are the different other types of salmonella, and yes, that's basically everything about typhoid fever and salmonella, typhoid fever and salmonella infections. Thank you.